Welcome back, friends. Today we are opening a door most people do not even know exists. Dental implants sound simple, permanent, almost magical. But Dr. Esma, there is a side nobody talks about. The kind of details patients only discover when it is already too late. That is exactly what we are unpacking today.
You are right, Rasim. Dental implants can be life-changing, but they are not a magic screw you just place and forget. There are risks, decisions, and silent mistakes that can affect your health, comfort, and even your wallet for years.
And that is the scary part. People hear success stories, but never the fine print. What questions should you ask before saying yes? What shortcuts some clinics take? And why two implants can feel completely different in two mouths?
Exactly. In this video, we will reveal what dentists rarely explain upfront, how to protect yourself, and how to know if an implant is truly right for you.
Let us make this real for a second. Imagine you finally fix that missing tooth. You smile, you eat, life feels normal again. And months later, something feels off. Pressure, discomfort, maybe even regret. Dr. Esma, this is more common than people think, right?
Very common, Rasim. Many patients are never told that bone quality, healing time, and even daily habits like grinding or smoking can quietly sabotage an implant. It may look perfect on day one, but problems often start later.
And nobody warns you that your body might react differently than your friends, even with the same procedure.
Exactly. Implants are not one size fits all. Rushed planning, skipped scans, or unclear expectations can turn a good idea into a long-term frustration.
Which is why staying with us matters, because what you do before the implant often matters more than the implant itself. So this really matters, because we are not talking about a simple filling. We are talking about something that becomes part of your body, within and beyond the lens. Dr. Esma, when things go wrong, the impact is not just physical, right?
Absolutely, Razim. I see patients who lose confidence, avoid smiling, even stop eating certain foods. One patient came in with an implant that looked fine, but it was placed at the wrong angle. Cleaning became difficult, inflammation followed, and stress built up over time.
And the worst part is, many people blame themselves, not realizing it started with poor planning.
Exactly. A well-planned implant can feel natural and last for years. A rushed one can quietly cause daily frustration.
That is why understanding these details now can save you years of discomfort later. Now here is where it gets really interesting. Dr. Esma, people assume dental implants fail because of bad luck. But there is usually a pattern behind it, right?
Yes, Razim. In my experience, a large portion of implant problems trace back to the planning stage. One mini case I always remember is a patient who skipped a detailed bone scan. The implant held at first, but after a year, bone loss started silently.
And from the outside, everything looked normal.
Exactly. Studies consistently show that proper diagnostics and timing dramatically increase long-term success. When those steps are rushed, the risk rises quietly.
So the real danger is not what you feel today, but what you do not see developing underneath. Alright, Dr. Esma, let us put on the science glasses for a moment. People hear titanium and think it is automatically safe forever. But the body still has a say, does it not?
Exactly, Rasim. An implant is not just placed. It must bond with the bone through a process called integration. That process depends on blood supply, bone density, and healing capacity. If any of those are compromised, the implant may never truly become part of the body.
So even perfect materials can fail in the wrong environment. And that is not just in the needs desire.
Yes, science shows that timing, surface design, and controlled healing are critical. Rushing this biology is one of the biggest hidden mistakes.
That makes this less about sales, and much more about respecting how the human body actually works. Alright, Dr. Esma, people are probably thinking, tell me what to do, step by step. Where does someone actually start if they want to do this the right way?
Great question, Rasim. Step 1 is a full evaluation, not just a quick look. That means detailed scans, medical history, and understanding how you heal. Step 2 is planning the timing. Sometimes waiting a few months gives far better results. Step 3 is choosing the right implant type and placement angle for your anatomy, not a generic solution.
So patience is actually part of the treatment.
Exactly. And the final step is follow-up. Proper care, checkups, and small adjustments early prevent big problems later.
That simple roadmap alone can change the entire outcome. Now, this is the part everyone should screenshot. Dr. Esma, let us talk clear do and do not. What should people be extremely careful about?
First, do not rush. Same-day implants sound tempting, but they are not for everyone. Do ask for full diagnostics and explanations in plain language. And never ignore discomfort that lasts longer than expected.
What about the big red flags?
If a clinic avoids questions, skips scans, or promises perfection, walk away. Also, do not underestimate aftercare. Poor cleaning habits and missed follow-ups quietly undo good work.
So, the smartest patients are not the fastest, but the most informed.